So, hello everybody, I'm Sarah Blundell. I work at NHS England and I'm the lead for Data and Analytics Professionalisation and Development. So I'm here today to talk a bit about the overarching programme of professionalisation and what we're up to in 24-25, to talk about the National Competency Framework and to also talk about the Data and Analytics Academy. So I hope you find it interesting. Please do add any questions on the Slido. If anyone hasn't already got started on the Slido, please do put them on there. So why are we doing this work? Now, I'm a data analyst of 19 years in the NHS, having done everything from an information officer on a band 3 in a hospital trust to where I am now in NHS England. And we're doing it because we really believe that working in data and analytics in healthcare is one of the best places to work as a data professional. And we want more people to know about it. We want to promote the career. And we really want to turn it into something we can all be proud of. The way we can do that is by professionalising who we are, what we do, and create a more vibrant data-focused workforce. Now, that's not going to happen overnight. And the only way it can happen is through collaborative action. I'm not saying, build the barricades, but what I am saying is we have a 13,000 strong workforce that if we pull together, we can standardise who we are, what we do, and how we develop ourselves. And that's at the core of what we're doing with the professionalisation agenda. My colleague Andy Lavelle is at the back. Wave, Andy, come on. Hi. So, if don't collar me for a question, collar Andy for one. But basically, when we're talking about the National Competency Framework, at the moment, as I said, it is focused on data analysts, data scientists, and data engineers. And that's how it's been developed. And that's what the core competencies are around. But it is expanding in 24-25 to include additional skills families around data ethics and data governance. And this is because it's about how we align as the data family to what was the DDAT framework and is now the Government Digital and Data Framework, which sort of groups up how roles across data, digital technology, information governance, cybersecurity, all these types of things, how they form under heads of profession. And we link up into data, it's the data family, and our head of profession is Ming Tang, who's also CDO for NHS England. So if you haven't met her, she's a lovely lady. You can see recordings of her online. So what are we up to in 24-25? Well, we're really quite busy, and there's 3 main areas of work that we're up to. National Competency Framework, which I'm going to go into in a little bit more depth, which basically, for anyone who hasn't heard of it, is a skills-based framework that allows people to baseline where they are in their careers around core competencies, skills that can be used to allow you to understand what I'm competent at, what I want to target, around data analysis, data science, and data engineering core skills, as well as specialist technical skills, as well as areas for, the broader, softer skills that are required as part of your job. Things like leadership and management, things around key behaviours like equality, diversity, inclusion, which are all things we're assessed against at interview and we're expected to demonstrate in our careers. Yet people never really tell us what are the things we need to do to get really good at doing this. How do we progress? How do we get better? And lastly, around working in projects. Now, this isn't turning people who are data professionals into project managers. They are a profession in their own right, and they work very hard to achieve those qualifications. But this is how to work really well in multidisciplinary teams, understanding core concepts of projects, and being a really good team player, so that as you move up and progress in your career, you learn the skills necessary to go from being an effective member of a team to someone who might be leading on program rollouts and software or analytical tools, etc. So as I said, National Competency Framework is there. In 24-25, there's sort of 2 main areas of work that we're doing. Firstly, promotion and adoption of the framework. It launched in October of last year. So you can go online and obviously catch up on any of Andy's LinkedIn videos if you've ever missed them. They're good fun, etc. You can go on as a member of Analyst X and go on our library of resources and catch up on the myriad of case studies and recordings, etc., to help you get started with the adoption of the framework. And we're really pushing the promotion and adoption. So we launched in October. We're now at 19.6%. That's very precise. 20% of NHS organisations across the country are adopting. There's obviously other local authorities, national organisations on top of that. We're obviously aiming to try and hit about 30% by our first anniversary. And that, when we're talking about pledging, this is organisations getting started on their journeys, using it for PDP-based baselining in their organisations, moving towards things like job description standardisation, looking at then how they might bring in more standardised training programmes, etc. It is a sliding scale of adoption, and it's about people taking it at their own pace. The second part of the work stream for the competency framework this year is its expansion. This is very exciting. So this is about how we bring in those core competencies for data ethicists, how we bring in the core competencies for the data governance areas, how we bring in leadership and management at a more junior level. And this is to align with things like the graduate management training scheme, because obviously they want to use the national competency framework going forward for their competencies. But they require demonstration of leadership skills at a more junior level. So this is going to be expanding and developing in this year with the idea of, come March, you then have a relaunched version that has all this additional content in. But we're also enabling people basically to go ahead and do those types of areas of work. We have the observatory piece of work. You can come to one of the observatory focus groups this afternoon, downstairs at 4 o'clock. Andy Lavelle is running it. And this is very much about understanding what makes us as a workforce tick. So not necessarily just counting the number of people, but actually let's get under the bonnet of some of those problems. And then lastly, the Data and Analytics Academy. So this is building on the foundation work that we've done in the competency framework and going, once you've done your baseline, where do you go next? How do you access the training and development opportunities that allow you to move from A to B on those scales? And obviously, as I say, I'll talk about that more in a second. So as I said, promotion and adoption, expansion and revision. This is the timeline we're working towards. It's always a tight timeline with us. We don't like sitting on our laurels. But things that you can be accessing now if you're interested in adoption. The podcast series is due to be imminently launched. We keep saying that. Andy will joke. But yes, there's been a really good recording for Series 1, which is about, again, short podcasts, people telling you about how the competency framework has been developed and how it's being used. Series 2 are about to start recording, which has been focusing on the user experiences, apprentices, all the way through up to directors of finance and why they're endorsing the adoption of the framework. Obviously, we've been out to regional skills development network conferences as well as these types of things. We have a fortnightly adopting support call. So new adopters can come along, get support, but also then that transitions into a routine adopters support call. So you can talk and chat to the people that are already adopting the framework. You can come along, you can find out what's new from the national team. We operated a bit like an agony aunt session, so if you've got a problem, you can ask your peers for advice and support, not just us at the national level. And on the alternate weeks, we then run the tool training. So if you're wanting to get to grips with the Excel-based tools, the different tools that we have, you can come along and have that training, etc. Ask those questions, get that support. And to be honest, you can come along to that training as many times as you like, because it's all virtual. And obviously, lastly, we have a library of resources on there, loads of blogs, contents, slide packs, etc. So we're not expecting you to become experts in the framework overnight. We're not expecting you, when you're taking it out to your teams, to become experts. We want to give you the tools to allow you to drip feed things into those team meetings at the pace that works for you. And then, as I said, expansion and revision. I've already mentioned the development of new core competencies for data ethicists and data governance. The working groups for that will kick off in September and run through from September through to sort of early November time. We'll then put that out for testing, etc. The literacy framework is the thing we're really excited about. So we actually kicked off the workshops for that back in June. So we're calling it now Data Confidence and Competence for the wider workforce, so the DCC, with the idea being this is a framework to allow people who work at ward clerks all the way through to board level positions to sort of baseline their skills, where they are, understanding the importance of data and why data should be applied in organisations and the type of data skills and analytical skills they should have. It's gone through the workshopping, we've got a test version, it's currently out online with surveys. We're going to be doing on-site testing in organisations in August. We want to get that out and available to all of you guys from November. Now, Data and Analytics Academy, I won't ask for hands up of who's heard about this, but this is the next stage piece from building on the foundations of the competency framework. There are 4 pillars. There are pillar 1, which is focusing on how do we standardise and make it easier for new entry talent coming in. There is upskilling, so how do we support the development of the core competencies and skills for that 13,000 strong workforce. There is leaders, so how do we develop the CAOs, the Mark Farrs, the Ming Tangs of the future from within our own talent pool? How do we develop data leadership skills? And then lastly, how do we help upskill that wider workforce for data literacy, etc.? So the idea, there is different areas of work that's kicking off for each of these pillars, and there will be something in place for all of them by the time version 1 of the Academy launches in April of 2025. We obviously want to build on that and then look at how we can provide bespoke national content. But obviously, if there's some things you're really keen and interested in, please do come to the 4 o'clock focus group because we will be talking about what are the sort of skills we think the future workforce is going to need and how we can best deliver on the training for those sorts of things. So, last slide. How can you get involved? Because obviously I'm hoping you come away from this inspired and wanting to get involved in areas of work. So from a perspective of advisory-wise, if you think I can help guide this work going forward, you can obviously, we have a stakeholder board that meets every 2 months, the Developing Data Analytics as a Profession board. You can hear updates from us, you can hear updates from the wider system, you can ask questions, you can get involved. Please just do contact me about that. I am sort of the administration and the co-chair for it. We also, obviously, when we kick off these workshops for the expansion of the framework, they only work if we have people from the system on those working groups helping us to define what goes in those frameworks. That's how we've always done it. It's not 2 or 3 of us in a little room in the dark coming up with things. It is about openness, transparency, and collaboration while we do it. And obviously then, from a hands-on perspective, you can really get involved joining in some of the thematic analysis workshops. We're really keen that when we're doing work for the focus groups for the observatory, that we're sharing our results as we go along, that we can get you guys involved in helping us create the insights, because there's going to be people out there who've got fantastic qualitative evaluation skills. Come on our podcast series. As I said, we are currently interviewing and asking people to come forward for series 2. So if you've got a really good adoption journey or you'd like to be part of the case study capture, do let us know. And then obviously, lastly, we host all of this on our Analyst X community, our community of practice peer-to-peer support for people active and interested in data and analytics across health and care. Join Analyst X. Be part of the conversation.
Thank you so much for that. We do have a couple of questions on Slido, and just to remind everybody, you can put your questions through or you can ask them directly, but probably best on Slido. The number is 3716942, if you caught that really quickly. We've got a couple through, several are coming through now. How can we target medics as well to ensure the wider workforce understand and collaborate with the input and benefit of accurate data?
Oh, that is a really good question. Obviously, there's things we need to do from influencing from a medics training perspective. So there's areas on that we need to be doing. One of the things we are doing on allied health professionals is buddying up with the professional bodies on that side, so Chartered Society for Physiotherapists and others on that area of work, because they are planning and are developing a digital and data learning program in partnership with Keele University that's going on the e-learning for health platform. So we've brought them in to the development of the data literacy framework so that we ensure that what they're developing from a training perspective maps into what we've done from a skills-based framework. So that's at the real early start of a 10, making sure that their training and their learning personas match ours, so there's proper join-up. But yeah, there's lots more that we'll need to do, but also how we expand the membership of Analyst X to be more medic-friendly.
Thank you very much. A couple more questions. You can upvote these if you go onto Slido as well. So the next one is, are there any existing links with, again, clinical, but scientists in this regard, who work in professions such as bioinformatics, genomics, medical physics, and engineering? They are big users and managers of the data in the NHS, but seemingly missing from the conversation.
Yeah, again, we had clinical scientists involved in the development of the data skills and competency competency framework, because at the moment they're not part of the core group of people for the National Competency Framework, even though we had some involved in testing. But they were then very keen on, actually what we need is core data skills that could then be applied to across roles, because we're not classing ourselves as analysts, because we've also got research competencies in all these other areas. So for us, it's about taking those core skills and creating a specific persona for those people that then would flow across that and our framework, and probably maybe some of the AI ones, because they do touch so many.
Are you looking to make links with health analysts who work outside the NHS, or those who wouldn't consider themselves an analyst, but who have very similar skills and interests?
Yes, yes, and yes. So it's a simple term. So obviously, when we're looking at adoption at the moment, although the primary area of people adopting are the competency framework are people from NHS trusts, we do have a smattering of local government, Norfolk County Council, Cornwall, Central Bedfordshire example. So we do have local authorities who are adopting it, which is great. Again, they have a different. Public Health Wales are adopting it. So there is quite a range of different types of organisation, as well as some in the private sector. Obviously, the challenge for us is what we've tried to do is make the data confidence and competence framework nest up into the analyst one. So it might be that there are people that are non-analyst roles who are doing data skills that sit across there, but if they want to then progress up, we then go, this is when you then transition into the analytical framework. This is when you transition into somewhere else.
I'm going to say thank you very much for the questions. There are a couple more, but we can try and get those to you a different way. But thank you so much, everybody, for your questions and for the talk.
Thank you.
And applause again. And now it gives